preventing heart diseases, there are few rules which you have to understand. Look before you eat. Healthy diets include plenty of fruits and vegetables, whole grains, lean proteins, low fat dairy, less salt, less sugar, less saturated and trans fats. Exercise, you have to maintain a level of physical activity of 150 minutes per week, which will keep you fit. Just walk. Just do a brisk walking. Stop smoking. Avoid smoking and alcohol completely. This simple lifestyle choices can significantly reduces your risk of heart disease and improves your overall health. About the exercises which I have told. Now, as I said, 150 of moderate intensity aerobic exercise. Now, what is aerobic exercise? Aerobic exercise are the exercise which requires oxygen, right? So, for example, swimming, walking, cycling, treadmill walking. If somebody wants to dance, please go ahead. So, aerobic exercise needs to be done 30 minutes in a day. If you're not able to do 30 minutes, start with 10 minutes, then progress 10, 12, 15. I am not saying that you have to walk half an hour. Don't take rest. Just walk, just walk. Nobody is telling you that. But it is very important to take rests in between because we don't know your stamina. So it is very much required to consult a physiotherapist so that they can make a tailor-made prescription for your own health and you can do exercises. Walking, doing cycling, doing swimming is not enough for your body. You have to do muscle strengthening exercises also. Now, why muscle strengthening and resistance exercises are important? Because howsoever our body's strength, our body's resistance has become very low nowadays. So it is required that at least 2 days in a week you should try lifting some weights. Now again, that depends on your muscle. So please don't try at home. Please don't just think that I will try with 1 kg of dumbbell or 3 kg of dumbbell and I'll start exercising. Please don't do that because physiotherapist supervision is very much required because they will do a proper assessment. They will assess you. They will understand how's your muscle strength, if you had any other problems prior. So please don't start the exercises your own because nowadays in Facebook, in YouTube, in Instagram, there are so many vloggers and influencers who are promoting exercises. Please do a one-on-one consultation with the physiotherapist so that they can make a tailor-made prescription, exercise prescription for you according to your body and the exercises which suits you well. Now coming to cigarette smoking, everybody knows, right? Cigarette smoking is one of the worst habit which our young adults, which many of the people are having, right? So smoking is one of the biggest risk factors for heart disease. Every cigarette contains thousands of harmful chemicals that enter the bloodstream and damages the inner lining of the blood vessels. Now, this damage causes the blood vessels to become narrow down. I was telling you about, right? Narrow, broad. As cigarette contains lots of harmful and intoxic chemicals, what it will do, it will make the blood vessels very narrow down. So it will become less flexible and it will make it harder for blood to flow to the heart. Now, smoking also raises blood pressure, reduces the level of good cholesterol, which we have just discussed, high density lipoprotein, and it increases the tendency of blood to clot. Now, this changes significantly increases the risk of heart attacks, stroke, and other cardiovascular diseases. The encouraging news is that the body begins to recover soon after quitting smoking. Blood pressure starts to improve, circulation gets better, and the risk of heart disease gradually decreases. And that's why the best time to quit smoking is today. cigarette smoking, as I said, if you are not consuming a cigarette, actually a cigarette is consuming you, because as I have told you, this intoxic chemicals are getting deposited in the body. It's not only the heart which is getting affected, it's your lungs also which is getting affected, and the chances of getting COPD, chronic obstructive pulmonary disease, getting any kind of respiratory disease are very common. Even lung cancer has become very common for smoking. So this is the best time to quit smoking. Coming to the most important topic, alcohol consumption. There is a common belief that drinking alcohol is good for the heart. However, this is often misunderstood. While some studies have suggested that possible benefits are actually there if an individual consume small amounts of certain alcoholic beverages, alcohol should not be considered. I mean, according to me, alcohol should not be considered as a treatment or a preventive measures for heart disease, and no healthcare professionals. I mean, howsoever research has been done, howsoever people are saying that if you have kidney stones, please drink beer, it will try to remove it. Please don't do any type of practices. Please don't practice any type of beliefs like this. If you have any problem, please go to the doctor, take proper medication. Please don't take alcohol as your medication. Now, excessive alcohol consumption can actually increase your blood pressure and unnecessary calories, which can lead to weight gain, damages your liver, and it also increases the risk of irregular heart rhythms and other cardiovascular problems. And it can also interfere in the medications which you're taking, and it also worsens the existing health problems which you're having. So, the key message is don't take alcohol. For people who are already drinking alcohol, it should be stopped. And for those who are not drinking, there is no health reason to start drinking for health protection. So I just want to give a take home message: avoid smoking and alcohol completely. This simple lifestyle choices can significantly reduces your risk of heart disease and improves your overall health. Coming to the most, again, one of the most important condition, diabetes. Now, diabetes mellitus, right? The complete name is diabetes. I mean, we often call it as diabetes, but the complete name of this condition is diabetes mellitus, correct? So, diabetes mellitus is a chronic metabolic disorder in which the body is unable to maintain the normal blood sugar levels, right? We all know diabetes happen because our body is not able to maintain the sugar levels. Now, why this happens? It's only about the food which we are taking? No. Correct? I mean, if I'm taking too much of sugar, yes, I'm at a risk of developing diabetes mellitus, but this is not only the reason. Now, this happens either because of the pancreas is an organ of our body. Pancreas doesn't produce enough insulin, or our body cells are not able to respond effectively to the insulin which our pancreas is producing. So insulin is in a hormone that helps the glucose enter the cells to be used for energy. So we cannot stop insulin, we cannot stop sugar completely, but it has to take in moderation. Now, diabetes mellitus is one of the strongest risk factor for cardiovascular diseases. Persistently high blood sugar damages the inner lining of the blood vessels, making them more narrow and stiff. It also accelerates the buildup of the fatty deposits known as atherosclerosis, which we have discussed already, increasing the risk of heart attack, stroke, and peripheral artery diseases. People with diabetes often have conditions like high BP, abnormal cholesterol levels, obesity, which can further increases the risk of heart disease. So if blood sugar is not well controlled over time, cardiovascular complications become much more likely. Now, if you go into depth of diabetes mellitus, there are many types of diabetes mellitus. There is first one which is called as type 1 diabetes mellitus, which is an autoimmune destruction of the immune producing beta cells of the pancreas. So the body itself is not producing enough insulin, which is required for the energy. Right now, the commonest is type 2 diabetes mellitus, which is very common in our society, very common in Indian population. Right, 90 to 95% of diabetes cases are type 2 diabetes mellitus. So if what happens in this, our body becomes very resistant over time, so insulin production may also decrease, so commonly associated with obesity, physical inactivity, like that. And the third one is gestational diabetes mellitus, the diabetes mellitus which pregnant women develops during pregnancy, right? Usually it relieves or resolves after the delivery, but it also increases the mother's future risk of developing type 2 diabetes, and it also increases the risk of developing diabetes, type 1 diabetes mellitus for the baby. Correct. And there are other specific types also, like there are endocrine disorders, there is some drugs which has been taken which can cause drug induced diabetes mellitus also, right? So for this you have to go for fasting blood sugar, random blood sugar. But nowadays doctors are not only relying on fasting blood sugar and random blood sugar, they are relying on an important investigation which is called as hb1ac, hb1ac, okay, which reflects your blood sugar, average blood sugar levels for over the previous 2 to 3 months. Now what is the normal? Normal should be less than 5 to 5.7%. If you are coming into a range of 5.7 to 6.4%, then you are pre-diabetic. And if your range goes beyond 6.5%, then you are diabetic. So yes, there's an interaction of risk factors which is happening. There is no clear cut line about blood pressure, cholesterol, overweight, smoking. There are many risk factors which are becoming clustered and giving heart diseases, and majority of the events arises in individuals with modest elevation of many risk factors. Now it is not only one risk factor which can cause, there are risk factors which are combining as a cluster in our body and giving cardiovascular diseases. So this was one of the proverb which I came across. Misfortunes always come in by a door that has been left open for them, right? So very relatable to the heart disease, that's why I have just put it. So every day you make choices to try to protect yourself and your family. In fact, protecting yourself has become second nature. You should do it, but do you know how you can protect yourself? I mean, I have just told you these are the conditions which can give, but how to reduce all that? How do I reduce the causes of heart disease is a very important learning objective which we are going to cover now. So this was again one of the most important thing which I came across. So every individual, right? I've just given an example of car. If I want to buy something, I want the best thing, right? If I want to buy a fridge, I want the best fridge which comes in my range. I want the best AC, I want the best car, I want the best dress, right? For everything I want the best thing, correct? But for my own body, I follow advices which are there in YouTube, which are there in Facebook. There are many influencers which are talking about it. We take advices from the friends, but going to a doctor, going to a physiotherapist is one of the best thing which you can do. Now, creative strategies do not actually work, right? If you are saying that I never had a test, I will not go to a doctor. I will take my own medications because he or she was taking this medication. I will not see any doctor. I am my own doctor. I know everything. This creative strategies actually doesn't work nowadays. You have to go to a healthcare professional to get a check on yourself, right? Now, preventing heart diseases, there are few rules which you have to understand, correct? So, the first thing is look before you eat. What are you eating? A heart healthy diets include plenty of fruits and vegetables, whole grains, lean proteins, low fat dairy, less salt, less sugar, less saturated and trans fats. Healthy oils such as mustard, olive, sunflower, soya bean, and groundnut oil are better choices. Avoid processed foods, avoid fried foods, avoid excessive oily foods in your diet. This is the rule number one which you can bring in your from your own house. Please try to limit food which are rich in cholesterol and saturated fats. Try to avoid much of yolk, egg yolk, fatty meat and organ meat, which is liver, butter chicken, milk fat like desi ghee. Again, desi, there are many people who say that desi ghee is not bad for our body, but taking excessive desi ghee is also not very good. Butter, cheese, malai, rabri, these are some of the dishes which needs to be avoided. Hidden fat like bakery biscuits, patties, cakes, pastries needs to be avoided. Okay, so cooking oils, there's a mystery of FUFA and MUFA. So saturated fats, right? We have different types of fats also in diet. So saturated fats increases cholesterol. So avoid taking vanaspati ghee, palm oil, coconut oil. Try to take monosaturated fats, which are healthy for your body, like olive oil, groundnut oil, canola oil, mustard oil. You can also take polyunsaturated fats, which are sunflower oil, soybean oil, or you can take omega 3 fatty acids, fish oil. All that things are heart healthy. You can take all these things. Rule number two is preventing your heart disease, right? Exercise. I have spoken everything about exercise. You have to maintain a level of physical activity of 150 minutes per week, which will keep you fit, and it will also matches your calories which you are taking. Several functions in preventing and treating those at high risk. You can reduce obesity, it will increase HDL, it will lowers down your low density lipoprotein, and exercise will also help in controlling diabetes and hypertension. So this was again one cartoon which I have seen, and I was talking about 150 minutes of exercise. So moderate to intense physical activity for 30 to 45 minutes day on most of the days of the week is recommended. Please do a physical activity, meet a physiotherapist. They'll make you a exercise protocol which you can follow every day and meet your bodily requirement. Walking for a healthy heart. As I said, aerobic exercise is one of the most important thing which you have to do. So complicated exercise machines and going to gym is not very essential. I mean, if many people say that they're going to gym, they're lifting heavy weights, but it might not be a very good thing for your healthy heart, because a physio will give you exercises or will make your exercise prescription in such a way which will meet your daily requirements of your activities of daily living. They will check your strength, they will check your range, they'll check the power of the muscle, they'll check if there are any other comorbidities which you are having, and then make your exercise prescription. So just one advice from my side, just walk. Just do a brisk walking. If you're not able to find 10 minutes of your time, time of yourself in a day, it's waste, right? So at least try to walk for 10 minutes. If you are not able to, take rest after doing 5 minutes. And I am not saying that you have to walk very fast. Just do a brisk walking. Walk very slow. It's I am not telling that you have to walk very fast. You have to swing your hand, then only it's called as exercise, or then only it's called as it's good for health. Just do brisk walking so that you can understand and you can feel the change in your body. Rule number 3, stop smoking. If you're smoking, please stop smoking right now. Don't encourage all these habits, because we know how bad it is for our body. Benefits much beyond the heart disease. This will, whatever exercise, smoking, all this, whatever I am telling, diet, it will not only help your heart disease, but it will also give benefit for cancer, diabetes mellitus, chronic respiratory diseases, osteoporosis, which is weakening of your bones, oral health, and mental health. So, the advices which I have given is not only for a healthy heart, you can implement all these advices for other life threatening conditions also. Rule number 4 is know your number. Know your number in the sense, not your mobile number, not your flat number. It is about the investigations. Know how much is your total cholesterol. You should have an idea about your LDL. You should know an idea about, you should know an idea about triglycerides. You should know your diabetes number. You should know how much is your BP. All these numbers are very important. At least cholesterol, diabetes, and BP. You should know what is your BP. Please go every week. There are many centers where, at least for BP, you can buy, if any elderly is at your home, please buy a sphygmomanometer, a digital BP machine, where you can just keep the cuff around your forearm and you can press the button. It will give you the heart rate and BP. It is always advisable, if you have not only, I'm not telling only about older people. Nowadays everyone should keep a digital BP machine and a pulse oximeter, so that you should know how much is your oxygen level, how much is your heart rate, and how much is your BP, right? So I'll not say go every week and do it. At least 3 months in a 3 months you can do a checkup, regular checkup, so that you know your numbers of your heart health. As I said, benefits, yes, if you do exercise, there will be 10% reduction in cholesterol. It can produce 20 to 30% decline in cardiovascular health deaths also. So controlling your blood pressure is very important. Blood pressure, we define it as high blood pressure and low blood pressure. Both are bad for our body. So high blood pressure is called as hypertension, where low blood pressure is called as hypotension. So adults should have their blood pressure checked it's written 2 years, but it's always good to check your BP if you don't have any sign and symptoms. Optimal level is 120 by 80, but nowadays the guideline says it's 130 by 90, because seeing the urbanization and the physical activity nowadays everybody are having. So if your BP is high, please modify your diet, take less salt. Now I want to ask, why everyone says that if you have BP you should take less salt? What is the relation between it? So if you take high amount of salt, your kidneys will be at fault. Now if your kidneys is at fault, it will give, or it will generate more pressure to the heart, and if it generates more pressure to the heart, your BP will increase. That's why they say that you should take less amount of salt in your food. And obviously exercise, please adhere to the prescribed medications which doctors are giving without fail, to decrease the chances of getting high BP, because high BP can give you cardiac arrest, it can give you stroke also. So it is very much important to control your BP. Control your blood sugar. I have already told you what are the numbers of HB1AC, FBS, and RBS. So if your blood sugars are high, please go ahead with diet. Please go ahead with your weight reduction, exercise. Again, adhere to the prescribed medications without fail. Don't miss your medications. If your sugars are very high, then doctors will give you insulin. Please take all that medications on time, because if you are not adhering to the timeline, it will again give you some life threatening conditions. Now, if in your family, if somebody has diagnosed with heart disease, don't lose hope. If you're already a heart disease, I mean, I don't know in this group of people is anybody a heart patient or not, but if you already have a heart disease, don't lose hope. Modern medications, the healthcare has advanced tremendously. By taking medications regularly, by exercising, eating healthy, quitting smoking, and attending regular follow ups, you can live a long and an active life. So don't lose hope. This is not for everyone. This is a link. I mean, this is a calculator, like how I have shown you the BMI calculator. In 2018, this is a calculator which has been made. Okay. So this is a tool which, or where you can calculate if you are at a high risk, moderate risk, or a low risk for getting a cardiac arrest. So you have to put the gender, you have to put your age, then which race do you belong to, what is your total cholesterol. Now again, this numbers you will not know until and unless you are doing an investigation. Total cholesterol, how much is your LDL, how much is your HDL, how much is your systolic blood pressure, is treatment for hypertension going on, if you had a history of diabetes mellitus, if you are a current smoker, or are you on an aspirin therapy. If you put down all the numbers, I mean, doctors will do that. Doctors will put down all the numbers and they will calculate if you are at a high risk, low risk, or a moderate risk. So this is a very nice calculator which has been made to assess individuals' risks of getting heart disease. So don't wait for a heart attack to take an action. Don't wait for a second life. We are not cats, we are not animals, correct? So if you are having any sign and symptom, please go visit a doctor, please visit a physiotherapist, so that we all can make your life better. We can improve your quality of life, we can improve your health. This is my final message. My final message is very simple, very crisp. Whatever I have said, don't wait for a heart attack to start caring for your heart. Small lifestyle changes made today can prevent major health problems tomorrow. Remember, healthy food, regular exercise, no smoking, control of blood pressure, sugar, cholesterol, regular health checkups. Your heart works for you every second of your life. So take care of your heart. So thank you everyone for your attention. I hope today's session was helped you in a better understanding of heart disease and inspired you to make your healthier choice.